Of the pediatrics department. Are you Mr. Pillmore?
Yeah, that's correct.
All right, Mr. Pillmore, I'm working under the team of doctors who are looking after Joshua.
Yeah, I'm very worried now about him.
Okay, I can understand that you're worried about Joshua, and he is in the resuscitation room right now.
Oh.
And our team of doctors is working to make sure that he is all right. But would you please tell me what happened to Joshua?
Oh, believe doctor, just today during lunchtime, we just went to a nearby shop for taking the lunch. Suddenly, Joshua just ran away, and he was just shouting, "Papa, Papa!" And the next time I just saw him, he's under the car, and I can't explain the situation. I just quickly called the 911, the ambulance arrived, and just we quickly rushed here. Doctor, can you please give me some updates about Joshua? I'm really worried at this point.
Yes, definitely. I can't even imagine how anxious you must be feeling right now. But I will assure you, you did the absolute right thing by calling 911 and bringing him to the hospital immediately.
Yeah.
As soon as you brought him in, Mr. Pillmore, unfortunately, we took him straight to do a CT scan, which is a scan of his brain. And unfortunately, we do not have very good news for you.
Oh God, is his current condition is very serious?
I really wish I can say that it's not serious, Mr. Pillmore, but it is quite serious. In fact, we've seen that there is a bleed inside his brain, and our team of doctors are doing everything they can to evacuate the bleed, and we are going to try to make sure that he is fine. And we have the best team of doctors working, so we'll do everything in our...
I can't believe this is happening.
I can't even imagine how you must be feeling right now, Mr. Pillmore, and I'm very sorry that I had to give you this news.
So, can we see him?
I understand, Mr. Pillmore, that you would want to see him right now, but as I've mentioned, he is being resuscitated at the moment. But and it might be a long time until you are able to actually see him again. So what we can do is I can arrange for you to see him for just a quick bit before he goes into the operation. Would you be okay with that?
Yeah, I think that would be okay. Do whatever best for him at this point. Rest is on your side, I think. I'm very worried right now, actually. So I have the consent for the surgery, so that's fine. You can go with
You're
the
okay
surgery.
with us going forward?
Yes.
All right. Thank you, Mr. Pillmore. Is there anything else you want to know about the operation?
About the surgery, after this surgery, do you think there going to be any brain damage or something?
Mr. Pillmore, I understand your concern, but hopefully in most of the cases the patients recover just fine without brain damage. But until we are done with the surgery, I cannot guarantee that he will not have a lasting brain damage, as every patient is different. But I will guarantee that we're going to give him the best possible care that is available. Mr. Pillmore, would it be okay if I ask you a few questions regarding Joshua?
Sure.
Would you be able to tell me if Joshua was well before this accident?
Yeah, I think he's a healthy kid. I think I don't think so. In my concern, there's anything to tell about his health.
All right. So he had no medical conditions, or was he on any medication?
No.
None of
He's
them.
completely healthy child and no such history like that.
All right. And no history of illnesses in the family?
No.
Not at all. All right. Was he allergic to anything?
Nothing special. Only thing in my concern is some strawberry, as far as I know, actually.
All right. Thank you, Mr. Pillmore, for telling me this. I will make sure that he is not given strawberries while he is under the care. But are there any antibiotics or any medication that he is allergic to?
No.
None at all. Okay. Thank you, Mr. Pilmo, for everything that you've told me, and I'm very sorry that I had to give you such bad news.
Yeah, and please do update us.
Yes,
about
I will
his
update you
condition.
with. I am working with the team, and I will be available. If there is anything else that you need to know, please do let me know, and I hope
Sure.
to come back with good news.
Yeah, I just hope so. Hope for the best.